Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Schaefer. This is Valley Health Minutes. We're so glad you're with us today. You know, routine visits to the doctor can keep us all healthy, of course. And today we're talking with Dr. Korey Mitchell about an annual wellness visit for adults and how that can be a real game changer. Tell me how important this is.
Oh, it's vital. And as a primary care provider, it's certainly something that I pay a lot of attention to. And having an annual wellness visit with your provider is an opportunity to not only update your medical information, but to really hone in on what your preventative care plan needs to be.
So tell me, what do we walk through during this annual wellness visit? What does it look like? What are you checking?
Yeah, absolutely. So an annual wellness visit, as the name implied, would be a yearly visit that we do. And we're going to look at kind of a big picture view. Sometimes we look at our routine visits as more a problem-based. It may be following up on, say, hypertension or high cholesterol or diabetes. But with an annual wellness visit, we're able to take a bigger picture view of your overall health. We're going to be looking at everything from not only your physical health, but your behavioral, psychological, emotional health. And this allows us to look at, appropriate screenings, things like immunizations, maybe even lab work, to really personalize your preventative health care plan in a way to not only look at your health, but to maintain your health.
So a lot of people would say, I feel fine. I could just wait another year, but those increments of a year really keep you on track.
Sure. So what I would say to that, and then we hear that a lot, we really want to take a focus of preventative health care. I think that is vital, something that we may not have always been good at in the past. And preventative health care, as the name implies, can prevent a lot of medical conditions. And if you have medical conditions, it can keep those conditions from becoming worse. And so, we want those folks to come in, even if things seem to be going okay. We want you to be able to come in and take a look at what we're doing right and be able to maintain those steps to, again, make sure that your health care is on track.
Just kind of small tweaks that can keep you on track.
Absolutely.
How hard is it to make an annual wellness visit? Does the office reach out to you? Do you reach out to your physician?
Sure. So it's an easy process. We do have folks in place that are monitoring those things, and they can reach out to patients to make reminders. But there's also several opportunities that, as a patient, that you have to do that. Obviously, you can talk directly with your primary care provider and work with them directly to schedule. We have multiple locations. Valley Health, you can reach out to any number of those locations, and our front office staff would be happy to schedule those. And then more recently, we've had access with a portal called MyChart. It's a wonderful access point for our patients, and you can log into your portal and you can schedule appointments from that standpoint as well.
Annual wellness visits for adults, but what about the senior population, those on Medicare? What does that appointment look like for them?
Sure, absolutely. It's very important. It's much like the annual wellness visit. Sometimes we refer to it as a Medicare wellness visit. Again, as the name implies, this is a wellness visit that is covered by Medicare for our Medicare recipients. It's structured much like a typical wellness visit, but there's a few little key differences for our senior population. And we get to cover, in addition to the typical preventative health measures, we're also looking at things like fall risks. We're looking at cognition, measuring cognition, and just looking at what potential, what we call ADLs, activities of daily living, things that might be needing of assistance, right? And so some of these things become important for our senior population, and so the Medicare wellness visit provides that little extra prevention care that we can offer our folks.
And sometimes as we age, we don't realize that little indicators in your daily life say you might have a problem. It's everybody has a hard time getting upstairs, but sometimes that means you need some medication too.
Absolutely, yeah. We see oftentimes, and I've said this to my patients before. Sometimes you don't in a 15-minute visit. Some things may not be obvious in that span of conversation. But when we're able to apply some of these specific screening tools, you may pick up on a little bit of that cognitive decline that nobody else has seen, or you might pick up on that little bit of that unsteadiness in our fall risk assessments that, had we not found before, might result in a fall and, say, a hip fracture, which carries a lot of morbidity and mortality. So those are the kinds of things that, again, preventative health care can allow us to avoid.
And that annual visit, that deeper dive that can keep you on the right track. All right. Thank you so much. We sure appreciate it, Dr. Mitchell.
Thank you.
Thanks for being here for Valley Health Minutes. I'll see you next Monday.